Welcome back. Amnesty International South Africa says there's a significant increase in the number of adolescent and young girls who are being impregnated. Girls as young as 10 have been reported to have given birth in some instances. It's a major problem in the country and has sparked conversation, especially in the last 2 years or so. Let's speak about what Amnesty International's take is on the issue. We can speak to Marike Keller, who's a researcher with the organization. Marike, very good afternoon to you. Welcome to Daytime Update. How does Amnesty analyze this problem in the country? What do you see as the driving factors?
Hi, Tembakile, and thank you for having me today. So early pregnancy is a social health and economic issue. So there are various contributing factors that play a role in terms of, for early pregnancy to occur in the country. While this isn't an exhaustive list, some of the contributing reasons include the lack of comprehensive sexuality education in our schools, stigma that's attached to sex, pregnancy and abortion in our society, the lack of access to comprehensive sexual and reproductive health services, including contraceptives, as well as the high rates of gender and sexual-based violence in our country. And over the past 2.5 years, COVID-19 has definitely exacerbated this.
And one of the things you've noted in your statement on the issue is that while we speak about the teenagers who are impregnated and give birth in a hospital or in another formal situation where the birth is actually registered, what we don't talk about is the total number of children, basically, who are being impregnated in this way. And previously, it has been said, much of it has to do with sexual grooming and sexual violence.
It definitely does play a role, and what we see is a lot of late registrations happening. So Statistics South Africa continuously updates the stats because as births are being registered, these do need to be increased. So they just very recently updated the 2020 statistics, and what we saw there was that over 2,600 girls between the ages of 10 and 14 gave birth, and over 91,000 between the ages of 15 and 19 gave birth in 2020 alone. And these figures are absolutely shocking.
You then say in your statement, I want to quote here, President Ramaphosa, it's time that you and your government take this issue of early pregnancy seriously. Why do you believe it's not being taken seriously?
We believe that as with a lot of legislation in our country, we have amazing policies and laws that are in place. What's lacking, though, is the implementation. So what we saw this year was the adoption of the policy on the prevention and management of learner pregnancy that was adopted this year. But again, more needs to be done because we're still seeing a rise in these numbers. So the state has a responsibility, a legal responsibility, and an ethical and moral responsibility to ensure that we have an enabling environment for young people to make autonomous and informed decisions. And that includes eliminating harmful stereotypes and discrimination, but also to implement effective, age-appropriate, and good quality comprehensive sexuality and education in our schools. That needs to be ramped up significantly.
And in order for those policies to succeed, you also need a situation where communities aren't themselves complicit, right, in allowing older men to take advantage of girls in this way that they're doing because of either economic benefit or because it's a relative in some instances.
Yeah, and it makes it a very multifaceted issue. There's not one clear solution. It requires everyone to come together to deal with this, to address this. So we are saying, while we are calling on President Ramaphosa to make this a priority, we are also saying, and what we mentioned in our statement as well, is that all corners of society have a role to play. It needs a holistic approach. We need society, we need communities, we need the public, and we need the state to take a stand against this and to have these important conversations. We shy away from this quite a lot. People don't want to talk about this issue. It's very taboo. But we need to talk about it openly. And it's only through that and by talking to our children about this as well, that we can lessen and decrease the stigma around sex, abortion, early pregnancy, and find real solutions and meaningful solutions to this.
Marike Keller, Amnesty International researcher, thank you for your time.